Hello everyone, welcome to my channel Pediatric Tutorials. I am Dr. Soumita Roy, pediatrician, and today we are going to discuss a short yet important topic, that is hemorrhagic diseases of newborn. So students, why this topic is important? Because you may get a short note on hemorrhagic diseases of newborns of 5 marks, and you may also get an explain why question, okay? Like why vitamin K deficiency, explain why vitamin K deficiency causes bleeding in neonate. Okay, this type of questions you may be getting. And for PGs, why it is important? Because it is very important to clinically diagnose a case of hemorrhagic diseases of newborn. Okay. And one common mistake students tend to do is when they are asked hemolytic disease of newborn, they feel hemorrhagic diseases of newborn and hemolytic diseases of newborn are same. But students, it's not so. Hemolytic diseases of newborn is a completely different entity, which is actually erythroblastosis fetalis. What is that? Incompatibility of mothers and fetal blood group. Okay, I'll be taking a separate lecture on that. Okay, so today let's focus on hemorrhagic diseases of newborn. So students, one thing, when you will be asked to write any short note, you just split it into parts like, first we will be discussing the etiology, next clinical features, next types, next is the diagnosis, treatment and prevention. Okay, so students, those who will be writing, rather mentioning all these points, I'm sure nobody can stop them from getting good marks like 80 to 90%. Okay, so what is etiology? What is hemorrhagic disease of newborn? Actually, any bleeding in newborn which occurs due to vitamin K deficiency, that causes the hemorrhagic diseases of newborn. Okay, and why this vitamin K deficiency happens in newborn, that is the etiology. Okay, first reason is there is poor transplacental transfer of vitamin K from mother to fetus. Okay, next is the hepatic vitamin K stores of neonates is very less. Next, the vitamin K content of breast milk is very low. Okay, and the last one is there is inadequate, rather immature gut flora in newborn. So vitamin K synthesis is less. So all these are the contributing factors of hemorrhagic diseases of newborn. Okay, done. Next is the clinical feature, very important. So you see, as I told you, for PGs, how will you clinically diagnose hemorrhagic diseases of newborn? So a bleeding neonate, yet well looking. I mean, not sick looking child. A well looking bleeding neonate, you should think of hemorrhagic diseases of newborn. Well looking. Right. So the bleeding manifestation may be intracranial, bleeding for umbilicus, bleeding from any prick sites, okay, and so on. So now the types. Basically, there are 3 types. First is the early onset. Second is the classical type. And the third one is, as there is early onset, so something called late or delayed onset will be there, right? So what is early onset? If the bleeding starts within first 24 hours of life, first 24 hours of life, okay, then you will stamp it as early onset hemorrhagic diseases of newborn. Okay. And what can be the etiology of this early onset? If the mother is on such drugs which is interfering with vitamin K function, that can lead to early onset. And what are the drugs, students? Like anticonvulsants, namely phenytoin. Okay, if the mother is on warfarin, if the mother is on salicylates, then it can lead to early onset type of hemorrhagic disease of newborn. Clear? And what will be the manifestation? There can be cephalhematoma, there can be intracranial bleeds. Next is the classical type. This is the most common type, and this manifests between 1 to 7 days of life. Clear? Okay. Next is the delayed onset. Okay, and one more thing, in this classical type, what happens, where from the bleeding occurs? Bleeding from umbilical stump. Okay, very important. A very catchy point is bleeding from umbilical stump. Next is bleeding from any prick site. Okay, that can also, you can think of classical type of hemorrhagic diseases of newborn. And the third one, rather the last one, is later delayed type. Here, the bleeding manifestation occurs after 7 days of life. But to be specific, it can go till 2 to 16 weeks. Yes, you heard me right. It's 2 to 16 weeks. And here also, what is the etiology of this late onset? If the child is having any malabsorption syndrome, or any cholestatic diseases of liver, or any cystic fibrosis, or any chronic diarrhea, then the child can have this delayed onset of this hemorrhagic diseases of newborn. Clear? And intracranial bleeds is the most dreaded complication. Okay. Next, diagnosis. How will you diagnose? If you are going for a lab diagnosis, first, like routinely, definitely you will order platelet, which is going to be normal. And what is significantly high? That is PT and APTT. That will be high. Okay. And students, will you be able to measure vitamin K directly in the serum? No. So, what is the proxy to vitamin K measurement? That is PIVKA. So, what is PIVKA? Very important from MCQ point of view as well. Okay. So, what is PIVKA? Protein induced by vitamin K absence. Okay. This is going to be elevated in vitamin K deficiency. Okay. So, moving on to the treatment. So, what type of treatment you are going to give? It's very simple. Just give vitamin K1. Okay. Injectable IM. And what is the dose? 1 to 5 milligram. Okay. Clear? So, that is the treatment, and if there is any active bleeds, then you will transfuse FFP. What is FFP? Fresh frozen plasma. Okay. And now moving on to the last part, that is prevention. How you are going to prevent vitamin K deficiency in newborn? All the neonates after birth should routinely receive injection vitamin K. Okay. Right? IM, it's given IM, and the dose is, if the birth weight is below 1 kg, the child is going to get 0.5. If the birth weight is more than 1 kg, the child is going to get 1 milligram. That's it. Okay. And for prevention, those who again want to get honors marks, for them, you need to mention 2 added points. So what are they? As I told you, if the mother is on daily warfarin therapy, if it's a case of early onset, then the mother should receive vitamin K injection. Okay. And one more thing is, if the newborn is sick due to some other reason, okay, and the newborn is receiving IV antibiotics for more than 2 weeks, that's damaging the blood flora. So you need to give injectable vitamin K every weekly. Clear? So that's all about hemorrhagic diseases of newborn. So students, I guess this video was helpful to you. So stay updated and we will be again meeting soon with our next important topic. Thank you.